Dr. Corinne Horn, Mary Weber. You recently got a facelift here at the Bassin Center.
I was one of those people that, I was always resistant to the idea because I wanted to kind of go gracefully, and I thought I looked pretty good for my age. And, when we went into COVID, you look at yourself head on all the time in Teams or Zoom or whatever. And so I kept thinking, I look pretty good. And then I was at an event where I was photographed from the side. And I was like, holy mother of God, what happened? When did this happen? Because it's not something that seems to happen gradually, just happened all of a sudden. And as soon as I could, I called Dr. Horn. I was like, all right, I'm ready.
How many months ago did you get it done?
A little over 2 months, about 10 weeks. It's basically fully healed, ready to go. You can't even see the scars. And the thing is, I have really short hair.
Yeah.
And you can't see the scars. It's amazing.
I saw you turn to the side. Turn to the side real quick. There's nothing. There's no scars.
No.
Dr. Horn, where are the scars?
Well, we hide them creatively along the hairline here, and then we go behind the little cartilage crux piece of the ear, and then sneak around the earlobe, and then back up the back of the ear and into the hairline. But I have to say, if you place scars in particular junctions where your eye doesn't catch them, then that's the ideal thing.
What would you say is the number one question people ask you?
I think most people want to be reassured that they're going to look like themselves and they're going to look natural. Nobody wants that windswept, I've been in a wind tunnel kind of 1970s facelift. And we don't even use those techniques anymore, to be honest. We use much more sophisticated techniques. We feel like patients are much more comfortable and come out looking more natural, looking like themselves, new and improved, not like a new person.
How much time is the recovery?
So I usually tell people expect 7 to 10 days where you're going to be not publicly acceptable. You're wearing a goofy compressive head dressing, kind of like I have a toothache kind of thing. And it really helps to compress the skin, and it helps to kind of lift things, and it helps to support the healing process. I'll ask that you stay out of the gym, which is hard for a lot of people, but you're not locked down. You can throw on a hoodie or a hat, walk to the grocery store, take the dog for a walk, which I know is important to Mary to be able to take care of the dogs.
Yeah. I looked like Tweedledee for about 3 or 4 days. I had no neck.
Swollen.
It was like my shoulders and then a head.
Mm-hmm.
But that's expected, right? So my recommendation would be try to do it, closer to weekend or something like that, because by Monday I was back on Teams calls.
What would you say to other people, Mary, thinking about getting it done, but they're on the fence?
I was on the fence about it for a really long time, and I'm super happy that I did it. I think that as people are working longer now, it's important to stay, to look as good as you can look. There's only so much you can do with what God gave you, and there's no shame. I'm not ashamed of it. It's not like a big secret. I'm like, oh,
sure.
People go, oh, you look great, and I'm like, I had a facelift.
Yeah.
And they're like, oh, your facelift looks great.
Yeah.
As opposed to God, did she have something done? She looks really weird.
Yeah.
My face looks great.
How long does a facelift last?
I would tell people, if you got a good 10 years out of it and you felt like, hey, I feel like new and improved for that period of time, time and gravity will continue to march on for sure. But the analogy I often give people is, if you have a twin sister and you do the facelift procedure and your hypothetical twin sister does not, you will set yourself back on the people mover at the airport, but you will each continue to march through time. Mm-hmm. So you will each continue to age, but you will always look better than your hypothetical twin sister for having done that procedure.